pointing to one of the more successful areas of recruitment, and that is actually having students from rural areas who are in med school and who would go back to rural areas. He's absolutely correct on that. In fact, I was handed just recently a research paper done by a medical student at Dalhousie, and he looked at other provinces and what they deemed to be the most successful means to get people to come to rural areas. And one of the most successful areas that he had documented, in fact, was Northern Ontario. And if we think of Northern Ontario with its isolated communities, its distant communities, and certainly remoteness in the Canadian Shield, certainly does exemplify great distances and small communities. And what they did was actually look at students who had applied to med school from some of these small mining and logging communities, and actually assisted with their education, and then put in place a 5-year plan for them to come back to their communities. And I think it's great for us to talk about this, and I know we're going to see in rural communities, we have Berwick, who just lost 2 doctors. Next year, this time of the year, in June, 2 doctors in Middleton will have announced their retirement a year ahead of time, obviously, to give their patients an opportunity to look elsewhere. And looking at the age of the doctors in some of the small communities of the valley, and I'm sure it's similar along our coastal communities, I'm just wondering, in fact, what are some of the concrete pieces that the department is looking at in getting doctors to come in and be the next generation of primary health care deliverers, our family doctor.
Thank you. The Honourable the Minister of Health.
Of course, each district, Mr. Chair, has a physician recruitment plan and basically a family practice physician practice plan to make sure that we have the types of professionals such as a family practitioner in each area. And you reference a challenge that we're facing in healthcare, especially when it comes to physician recruitment, is that as some of our older docs are retiring, we're finding that as we're finding that is requiring more doctors to replace a single doctor, and their patient loads are different. The new breed of doc wants to have certain lifestyles, wants to have families, wants to have time to do things correctly. So we are finding it more of a challenge to find these family practitioners to come to our area. But I do want to say that in the last number of the last year, so 05-06, in our communities, that the DHA3 has received some doctors recruited. So Middleton received 1, Annapolis Royal received 1, Kentville saw an increase, or at least doctors recruited of 4. Wolfville had 2, and New Minas was able to recruit 1. So, I think by looking at the other districts, the Valley District is doing quite well compared to other regions of the province on recruitment. So, as the plan continues and we continue to look at the remuneration of doctors and making sure that they have the correct fee-for-service plans or what have you, to make sure that they have due remuneration and are comfortable in those communities. It's also, I think, important upon our communities to make our new doctors comfortable, to make them a part of our communities, and I think which has been a challenge for a time, and I think it's very important for our municipalities and towns to do their best to help us keep those docs as they come in, because retention, in my estimation, has been just as much a challenge as recruitment has been.
The Honourable Member for Kings West.
Thank you very much, Speaker. and I thank the Minister for that overview. There's no question that when I do meet with the CEO of District 3, the Valley District Health Authority, one of the references that is often given for a model that is working extremely well is what we currently see in Annapolis Royal. There's no question that we're seeing it from the point of view of the doctors and the other medical practitioners, and from the patients and from the community. We see a very, very strong approval of that model. Looking at certainly two little offshoots here. First of all, I know that I live close to an area that's such a collaborative practice, and I don't mind using estimates to both promote and to ask the Minister, are there other areas of the province being looked at? Because when I take a look at the Kingston-Greenwood area, in my view, it's one of the population growth centers of the Annapolis Valley. It also has a transient population. We get a lot of, when I go door to door, and we're now less than 4 weeks since we've gone door to door, and in the Greenwood, Kingston area, I had a lot of questions and a lot of asks about what is government doing, what are you prepared to do to support more doctors in our area. And I certainly think that the Kingston-Greenwood area, possibly even collaboration with some of the doctors that provide the service personnel on the base with their service, may in fact even be able to be incorporated into a collaborative practice for that area. And I'm just wondering, in fact, is that the model that is going to be expanded? If we're taking a look at, there's 5 counties now of the 18 in the province that still have some population growth going on. And I certainly think that Kings County in general and District Health Authority 3 certainly has to look at the provision of expanded medical services. And I'm just wondering if this is one of the models that can be applied to an area that is under extreme pressure for family doctors. Certainly, in my view, having a family doctor is still one of the great and important pieces that we all need in terms of our health. And I think in health, in promoting good health and in having that history of the patient is a critical piece, I think, for good care. So I'm just wondering if the Minister could provide some insight on that area, and if in fact there is budgeted dollars to start to look at that kind of model.
The Honourable Minister of Health.
Thank you very much, Mr. Chair, and to the member opposite. We're talking about primary health care collaborative practices, which is, I guess, not much of an acronym, but a good explanation of what we're talking about as we talk about doctors and other practitioners in the same setting. Annapolis Royal, of course, is a very good example of what can work and how we can alleviate some of the problems that we've had in other areas. Other areas that we've seen some of the same type of setup, of course, in Tatamagouche, we're looking at the North End Clinic, the Duffus Street Clinic, and then a couple other places in Advocate where they basically have a central node for the physicians. The physicians will travel to some of the other communities held within it. So I think more and more, especially as the new doctors are graduating and coming into our system, they're finding that these collaborative practices work much better for them because they are trained in more team settings and require a little bit of work together. And I think also what we're seeing within these collaborative practices, we're also seeing that we're also seeing that they have a little bit better quality of life, that they're able to depend on one another to fill shifts when someone is not feeling so well or has other responsibilities in the community or at home. So we will continue to try to expand these as different communities come forward and propose these to us. I think that is the key right now to rural family medicine, is definitely to try to incent and make sure that we have more of these collaborative practices across the province.
The honourable member for Kings West.
Thank you, Speaker. I'm not sure, Mr. Minister, if that was a yes to the Kingston-Greenwood area, but the overall tenor certainly of your direction is appreciated, and certainly hope to work with you in this area of shortage. One of the areas, though, I do have to be critical of government on, and that is the implementation of nurse practitioners into the system. Now, I know we do have a few that are working, but when I take a look today, and I have talked to a couple of the doctors in the Berwick area, where they have just recently lost 2 doctors, they feel that a nurse practitioner in their system, where they have, in fact, at least a couple of the doctors that have their offices right in the medical center, and if we had a little bit more flexibility in that program, I think it's one that could certainly alleviate a lot of pressure on the doctors in an area where we are feeling the pinch of shortages. And so again, I'm wondering, what the plan is. Are we going to be able to get nurse practitioners in that clinic type setting where you already have an array of services being offered? And I feel that diverting 20%, and I'm not sure what the goal is with a nurse practitioner, but if we could divert 20% of patients coming in to the medical center, like in Berwick, or outpatients at Soldiers Memorial, or any of the health centers, I think it's one of the real saving areas that we can approach. And again, probably like you, Mr. Minister, perhaps 1, 2, or 3 of these people who are trained as nurse practitioners. And certainly when I look at the background, and I look at 2 or 3 in our area, and in fact we have one from our area that is actually doing some practicums here in the city now in the nurse practitioner role. And I absolutely think it's a piece that is worth the initial investment for the enormous long-term savings that we can start to generate in our healthcare system. So I'd just like for your comment there. Is there a 1, 2, 3 step kind of program that will see more nurse practitioners on the ground in Nova Scotia?
The Honourable Minister of Health.
Thank you very much, Mr. Chair. And I can commit to the member opposite that we will continue to expand the nurse practitioner services across this province. We do talk about the 19 that we do have in the province. We still have a couple of vacants to fill at this point, but we do want to continue to expand those. Mr. Chair, also within the district health authorities, they do have a lot of leeway on the kind of professionals that they hire within their systems as well, and we do urge the DHAs to use a nurse practitioner in their complement of professionals at the clinic level, at the hospital level, and whatever they feel they can use the services of a nurse practitioner for. So I can say to the member opposite that we will continue to expand the services of nurse practitioners, the services or the positions for nurse practitioners. The challenge had been really is how they collaborate with a physician, where the medical oversight comes up, and also the billing piece, which is where we had to make a decision to flow the funding from the department through the DHAs for the time being on the payment of nurse practitioners. But I will continue to commit on the expansion of nurse practitioners in this province.
The Honourable Member for Kings West.
Mr. Speaker, and I thank the minister for that certainly positive response. It's one that I think whose time has come. Just a couple of other areas. Recently, on a visit to Valley Regional, and in speaking with the chief of staff there, one of the concerns raised was the pay differential for anesthesiologists. And I know that certainly the cases that you would find in Capital Health or at the QE2 certainly are ones that are more complex, much longer operations perhaps than some that are performed at Valley Regional. And again, that could be one of the deterrents from attracting and maintaining the appropriate level of anesthesiologists at Valley Regional. And it's one that I'm wondering, if the Department of Health and if the minister is aware of, and again wondering how that will be addressed if it hasn't already been addressed. We know that for Valley Regional and our regional hospitals to perform their functions of, if not certainly not tertiary level care, but certainly secondary level care, they have to be able to have anesthesiologists. So I was wondering if the minister could make some comments in that regard.
The Honourable the Minister of Health.
Thank you very much, Mr. Chair. And the anesthesiologist issue had been one that those professionals had been underpaid for some time, which we started a couple of years ago to bring their levels of pay back to a Canadian standard. And basically, they have been stabilized and competitive. And the chief of surgery, or the chief anesthesiologist at Capital Health, who is at the current time trying to recruit some, feels that he will be successful in doing that with the current pay scale for those professionals. We also have been able, through physician services, to be able to come up with an alternate funding plan for anesthesiologists, which is now available in Capital Health, Dartmouth General, those areas, and I do believe those will be rolled out across the province, so that all our anesthesiologists will receive their due remuneration depending on where they are in the province. But I think with those changes and stabilization and making sure they're competitive will bode well. The also part that we've talked about leading a development of anesthesia assistants as well, to make sure that we have some supports for these anesthesiologists, that they have an assistant or those types of people that can do some extra monitoring, and hopefully expand the service that we're offering for surgery and other uses at this point in time.
Thank you. The honourable member for Kings West.
Thank you, Mr. Speaker. I thank the minister again for that direction in which perhaps there can be some certainly measure of assurance to the anesthesiologists working at Valley Regional, perhaps at other regional hospitals, that fairness for compensation certainly will be the order of the day. One of the other areas that I certainly keep hearing about in my riding office, and as I talk to health professionals, we know that home care is certainly a critical piece now in the delivery of good health, and allowing patients to come out of hospital much quicker than we certainly did in the past. However, once again, there are the difficulties that is often there. We hear, for example, my most recent case was a stroke victim who was now home and had no help for 5 weeks. And it was in those first 5 weeks that her family was trying to help her cope without even any kinds of support. And what they were looking for, as much as anything, was to have home care come in and help them deal with basic cleaning and hygiene and so forth for their parent. And one of the things that keeps getting suggested to me, and I'm not sure if in fact there is strong documentation and good research and so on to support it in Nova Scotia, but I'm one that while we do adapt and take from other jurisdictions, I like made in Nova Scotia solutions, and I'm wondering if in fact downloading the home care to the DHA and allowing for the administration of it in a more localized versus the centralized for something like home care, in fact, may be a good way to go. And I'm just wondering if District 3 or one of our districts would be willing to pilot and take a look and see, in fact, if there can be greater efficiencies, more timely delivery of services, and certainly the efficiency piece. I know the geography of areas sometimes is not always accounted for in the delivery of home care. And I'm just wondering again if the minister and deputy are looking at this piece and are able to offer Nova Scotians again some small tangible improvements. We know that there are some there are great strengths in this program. I know some of the people in our area that work in home care, and I know that it's a matter of some fine-tuning, some extra resources, and I'd just like to know where the department is going in this critical area.
Thank you. The Honourable the Minister of Health.
Thank you very much, Mr. Chair. And through the continuing care strategy, we talk a lot about home care and different programs that we can bring forward to help the care of our seniors in their communities. And it's been exceptionally tough for the Valley. It seems that we have definitely a personnel problem, that we just cannot get the continuing care assistants and the home care workers that we require to provide the service. Even to the point that a lot of the people offering the service tend to be married to some of the personnel at the base in Greenwood, and of course those tend to be transients as well. They come in to do services, and of course one of their spouses end up getting transferred to other bases. So it has created quite a bit of a challenge for us in the Valley region. And to the point where we're continuing to work with the Nova Scotia Community College in the training of continuing care assistants and people that we should be able to offer those services in their area. We're currently investing in about $900,000 on the recruitment of continuing care assistants. We are working on a marketing campaign to offer this as a profession to Nova Scotian students and other people looking at changes in their professions. We're also offering bursaries to those types of professionals. So I think we're doing a fair amount to try to bring up that pool of workers to alleviate the problem that we're having in the Annapolis Valley. I also want to underline a couple other programs that we're talking about that we do have some funding for and expansions. Of course, the self-managed care program, which is one I think that has had good uptake, which allows patients with some complicated illnesses to get the professionals that they need for home care and other pieces. Increased home support, that we are investing another $2 million, to try to expand programs in areas. And of course, community initiatives that we're trying to do to alleviate some of those ALC pressures of the $3.6 million. So we are trying our best to try to keep that system alive, but we still have one of the we do have the longest wait time for home care services in the Valley. In the Valley at this time. Some of the other things we're trying to add portable home oxygen, more respite care, more palliative care to help out the families take care of their loved ones, because I think that's very important, that there are a lot of people out there that would really want to take care of their parents, yet sometimes don't have the financial means in order to do that, which I think is very important, that a part of the continuing care strategy, that we move into the what we call the caregiver strategy, to make sure that we have the points available to families to take care of their own as well. So I think we're well on our way, but the concern for Annapolis Valley will continue to be one of personnel to make sure that we have people available to fill those positions.
Thank you. The honourable member for Kings West has approximately 2 minutes.
Thank you. With just 2 minutes left, then I guess I'll depart from that area of home care, which the minister has outlined and recognized some of the unique problems that we do have in District 3. And he didn't commit to a pilot program of decentralization, but maybe that's one that in time we will be taking a look at. Just very quickly, wondering with the EHS service, does that come under his ministry directly? And if so, if there is a need to look at fine-tuning and so on in an area, I'm just wondering if that's his area of responsibility.
Thank you. The Honourable the Minister of Health.
Thank you very much, Mr. Chair. And yes, the answer is EHS is a part of our department. The ground ambulance system, the life flight system, and all the components that go with that. We're very happy with the system as it stands today. We are very happy with response times and the service that they provide to Nova Scotians. Mr. Chair, this system, in my estimation, is the best emergency health system in Canada, if not in North America, but we continue to monitor and make sure that the service is available to all Nova Scotians at all times.
Thank you. The honourable member for Kings West.
With perhaps not enough time to do a follow-up on that question, I will see the minister about a specific question, and I want to thank him and his staff for providing me with some of the background and solid pieces of information to continue to work with the department. So thank you.
Thank you. Before the chair recognizes the next speaker, we will take a comfort break to allow the minister and his staff and others, so that the committee stands recess for a few minutes. Thank you. Order, please. Order, please. Order, please. The Committee on Supply will now reconvene. The chair will now recognize the honourable member for Halifax Needham.
Thank you very much, Mr. Chair, and I welcome the opportunity to ask a few questions to the Minister and his staff. I want to focus in the beginning on mental health services. Mental health services often don't get their due. They have some pretty heavy hitters to be in competition with, when it comes to healthcare services. Things like cardiac and cancer, and often because there's so much stigma associated with having a mental health disorder, I think that maybe sometimes the public will to make this a high priority and see the kinds of services and resources that are required isn't always as strong as it is in terms of some of these other also very serious areas of need in terms of healthcare. We've been here in the province of Nova Scotia, we have seen on the front pages of our paper the concerns around various individuals who are stuck in forensic units, who are inappropriately in front of the courts. And I want to ask the Minister specifically around seniors with mental health disorders who are in need of 24-hour care, but who are aggressive and known to have the occasion to have violent outbursts and are inappropriately, it would be inappropriate to place them in a general population of seniors. What does the government of Nova Scotia have available right now for these seniors, and how will this government address the gaps in the services that are available for the seniors in the short term, in the very immediate term?
The Honourable Minister of Health.
Thank you very much, Mr. Chair, and I thank the member opposite for taking her time here at Estimates and asking questions about a very important issue of mental health, and more specifically at this time regarding the safekeeping, the care of some of our seniors with the challenging behaviors, and and I will admit right now that the current system is a little lax and a little not quite available to these types of individuals, quite sadly. As we talk about expanding in near term and short term, that there's already been a commitment from the Minister of Community Services for a 5-bed unit or so as sort of an interim step to try to take care of some challenging behavior people, but also a joint facility, as we've been discussing over the last number of months, between Department of Health and Department of Community Services, to take on the role of those folks that don't belong in a forensics hospital, that don't belong in another type of facility. We still have a lot of work to do in so far as that, but at the time being, we are trying to place these folks in the best facility possible, some of them being long-term care facilities with challenging behavior units and other types of facilities across Nova Scotia.
The Honourable Member for Halifax Needham.
Well, thank you, Mr. Chair, and I want to thank the Minister. But, I can't begin to tell you how frustrated I am with this government's response to a problem that we have known about now for probably a year and a half to 2 years. It doesn't seem to be improving. It seems to be getting worse while these discussions are going on. So I don't know what the problem is in terms of the ability to act, but there is no action. And, you know, with all due respect to the Minister of Community Services, a 5-bed transitional unit will not even begin to address the problem. I'm talking specifically about seniors and, a growing senior population to begin with. But in that population, people who have mental health disorders and who, as a feature of those mental health disorders, will be aggressive, agitated, and will in fact expose staff in situations to violence in the workplace, which is in itself a problem, but also other frail seniors. They can't be placed in a long-term care facility with other seniors who are frail, vulnerable, and the patient-staff ratio such that there isn't that constant supervision standing over those people. So I want to come back to that specific question about that specific population, and the question is, where now in the province of Nova Scotia are there beds for seniors who have mental health disorders, who are aggressive? And if there are none, when will we see some in the short term to deal with a very serious and growing problem? That's my question.
The Honourable Minister of Health.
Thank you very much, Mr. Chair, and to the member opposite. There are a number of facilities now, and I am assuming that she's talking about people that have been assessed that require long-term care. So these are the ones that are moving into long-term care facilities. That there are a number of facilities across this province that have challenging behavior units, Alzheimer's units, as some people identify them to be, and they are various places around the province. Which is a concern. You know, as these folks move into populations, the busier it is, the more agitated they are in most cases, and they do require different type of care, and it's one that we'll continue to expand upon. I got to say that in this budget there was an extra $670,000 in the budget for challenging behavior. So this expansion of some of these facilities, extra care by professionals, as well as another $225,000 in the continuing care strategy. So this year alone, we're focusing about $895,000 towards challenging behaviors and making sure that these seniors are protected and taken care of in the proper manner.
The Honourable Member from Halifax Needham.
Thank you, and I want to thank the Minister. Mr. Speaker, or Mr. Chair, I want to ask the Minister about a specific proposal that was in front of his department, as well as the Department of Community Services, from an organization that's based here in Metro, that's well known to me for the very excellent work they do with homeless people and hard-to-house people. And this is an organization called the Metro Nonprofit Housing Association. And they had a proposal in front of your government regarding supportive housing for people who have both addictions and mental health disorders, who are very hard to house, who are overrepresented in the homeless population on the streets, overrepresented in the emergency shelters throughout HRM, and who are often exploited, I guess you would have to say, by a class of landlord that offers less than desirable living conditions for people who have serious health problems. So this organization have been trying desperately to get the government to recognize the need for supportive housing. This is housing that will have staff available to ensure that people are eating properly, getting medications, and it's precisely as it says, it's supportive housing, which means that there's a staff component, which means there's a cost component. It's not just throwing these people into the community and having a friendly visitor drop in once in a while. It's having people right there who can really monitor and support people on a very regular basis. It's a model that has worked in other areas. There was an excellent presentation from a group from Toronto here, the Canadian Mental Health Association, brought in for one of their annual working educational public conferences, who did just this phenomenal presentation on what that has been able to achieve in the city of Toronto. So I want to ask the minister whether or not his government, his department, will be providing financial support to Metro Housing for the supportive housing initiative, and when if support is forthcoming, when will we see that?
The Honourable Minister of Health.
Thank you very much, Mr. Chair. And to the member opposite, I am unaware of a proposal from the Metro Nonprofit Housing Association, nor is my Deputy Minister aware of it. What we are aware is that there are discussions ongoing right now with Capital Health with that group, and I can commit to the member opposite that we will continue to have those discussions and look at the proposal that is being brought forward, and I'm sure with other partners that would be required on this, namely community services. But I do believe at this point that there is just discussions ongoing with Capital Health that we are aware of at this point.
The Honourable Member from Halifax Needham.
Well, thank you, Mr. Chair. I'm confused about, I'm confused that the minister and the deputy are unaware of the proposal. I had this proposal probably a year and a half, 2 years ago. I know that, is it Mr. Campbell, Mr. Jim Campbell, perhaps, in your office have been in regular contact and involved in discussions with Metro Nonprofit, as well as representatives from the Department of Community Services. And I've seen some correspondence with staff from the minister's department. So it's not solely in the purview of the Capital District Health Authority where this is happening, although it may have been kicked back to Capital District. But the point remains that this is a population that is crying out for the appropriate living conditions in the community, and just not receiving the kind of support and attention that's required to make what would be a very important service a reality. I want to ask the minister, at what stage is the department in providing patient advisors to people with mental health disorders who are now in hospital under the Involuntary Treatment Act? I don't know that the regulations have all been finished around the Involuntary Treatment Act. Perhaps they aren't. But I would like to know where we're at in the stage of implementing the Involuntary Treatment Act and putting in place patient advisors.
The Honourable Minister of Health.
Thank you very much, Mr. Chair. And the funding is before you within this budget for the funding for the patient rights advisors. It is our understanding of the process, or my understanding of the process, that as soon as these, as we get approval for the funding here, we will complete the selection process as it's been undergoing at this point. And then once the patients' rights advisors are in service, then we can complete the regulations in far as the the Involuntary Treatment Act. So that, I think, is the process. So as soon as we can get approval, hiring, act.
The honourable member for Halifax Needham.
Thank you very much, Mr. Chair. There are so many things I could ask, and I have to limit my time and share it with my colleagues. I'm going to move from mental health and ask the minister about a concern that we've had here in the NDP caucus for quite some time, and that's a concern around ambulance fees. And I want to tell the minister of a situation that I had in my constituency with a constituent who's over 80 years old, who has a life-threatening blood disorder, who lives in a senior citizen's manor independently, not in a nursing home, who loses consciousness because the oxygen count in her system, her blood is such that she doesn't get oxygen and she passes out. And she had to be taken to the Queen Elizabeth Health Center because of one of these fainting spells. She was admitted. She was in hospital for a number of days. She subsequently received an ambulance bill in the vicinity of $500 or so. Eventually, that account was placed with a collection agency in Newfoundland. This is a woman who lives in a low-income seniors residence, and she has very limited income. She was called and harassed, I think is the only way to put it, to pay these ambulance fees from this collection agency in Newfoundland. And in the course of that attempt to collect on these outstanding fees, the collection agency in Newfoundland were under the impression that she was a person who was gainfully employed and had absolutely no good reason not to be paying those fees. And I can't tell you how upset and agitated this lady was when she called me. She's 81 years old, she's very frail, she's not in good health. Her use of the ambulance was not frivolous, it was because of a life-threatening situation. Now, I use this as perhaps it may be one of the more extreme examples of what we see, but the former Minister of Health made a commitment to the members of this caucus that there would be a review of ambulance fees. And I'm wondering where that review is at. Has the review been conducted? Is there a report? What is the department's position with respect to the outsourcing of the collection of ambulance fees to collection agencies in another province and these kinds of incidents? I'm sure the one that I had with my constituent isn't unique.
The Honourable Minister of Health.
Good. Thank you very much, Mr. Chair, and through you to the member opposite. Of course, I can talk at length to our EHS system and the program and the service that it does provide to all Nova Scotians. And it's unfortunate that your constituent had to go through such harassment from the company or from the Newfoundland company in trying to get that fee back. But I can commit to the member opposite that if it has not been resolved, to make sure that she does get that information to me so that can be resolved. As I'm sure that we do pay for 91% or almost 92% of all transfers and fees in the province to date. As far as the independent review has been taken, the review is provided to the department at this point and is currently being reviewed by staff. So I'm hoping to have some of those recommendations brought forward for public dissemination, make them see what their thoughts are on it, because it does show some very interesting things, but it does put us very much in line with other Canadian provinces and how the fee service is being charged to Nova Scotians and to patients in Nova Scotia.
The honourable member for Halifax Needham.
Thank you very much, Mr. Chair, and I want to thank the Minister. I very much look forward to seeing the result of the independent review. And, you know, this caucus, we have some concerns about the growing amount of public-private partnerships in healthcare delivery, and it's not all a rosy picture. The kinds of things that result for the citizens of Nova Scotia when they need health care, and certainly the positive part of EHS is the outstanding service that people receive, which I've witnessed firsthand, and have heard so many positive stories from one end of this province to another. The staff are professional, they are efficient, they are caring, and they do an outstanding job. But when you look at then the placing of accounts with collection agencies that don't, first of all, aren't in the province, you know, secondly, have no idea who they're dealing with, and the kinds of, you know, fairly strong-arm tactics that get used in the field of collections generally. That's what it's all about. It's collecting money, and the fact that you're dealing with people who are frail, elderly, sick, poor, all of those kinds of things really don't make a hill of beans of difference to the person. That faceless person who's on the other end of the phone is one of the really negative downsizes of public-private partnerships. And it's the people of the province of Nova Scotia who pay in more ways than one for that. I recently had a situation where a constituent contacted me to talk about a serious health care problem, and it was a situation where somebody needed to get to the emergency department, and because they were so concerned about the fee that they would face if they were taken there with EHS, they weren't prepared to call EHS. And this was a cardiac situation, you know, and you have to ask yourself, this is exactly what the studies have shown around letting fee-for-service come into our healthcare system. The impact is that people who don't think they can pay will in fact not use healthcare services when they most need them, either for the kinds of preliminary intervention that can actually save us money down the road, because the more critical levels of care won't be required when things hit a crisis. So, you know, I think this is, I look forward to reading the review and seeing how ambulance fees have been assessed and their impact and what have you. And I assure the Minister that if we don't see that review soon, we'll be coming after it over and over again till we do. I have two more things I want to ask. One, I want to ask why on earth the government of Nova Scotia hasn't done anything to intervene in the disgraceful situation of Dr. Michael Goodyear and Gabriel Horn. This has gone on now for 3 years. And I understand all of the stuff around litigation, and you don't want to get involved when there's litigation going on. But you know, this is not acceptable. It's not acceptable to me as an individual in this House to see that, you know, an organization like Dalhousie University has to play a leadership role in asking the government of Nova Scotia and urging Capital Health to, you know, deal with this. And If government has any power at all, then they certainly have the power to do something in this case. And it's unacceptable that anybody, any individuals, and particularly our health care experts and providers who we desperately need, just as much as we want to create a positive business community, we should also want to create a healthcare environment that is a really strong healthcare environment for our professionals. And people who do research, oncologists like Dr. Goodyear, I mean, for heaven's sakes. So I want to ask the minister, are you prepared to allow this to go on, or do you have any intention of trying to facilitate a settlement and bring this disgraceful situation to an end?
The Honourable Minister of Health.
Thank you very much, Mr. Chair. And there is no real legal framework for us to interject. Yet we can be, the sober second thought and urge certain parties to sit down and discuss this situation that is unacceptable and has been going on for far too long. We have already had Capital Health sit down and come up with a number of recommendations that are being reviewed currently by the Board of Capital Health. We're also urging Docs Nova Scotia to change some of their guidelines that would allow these two physicians to practice. So we've been very active in the last number of months to make sure that we have the parties talking and making sure that these two physicians continue to offer service to Nova Scotia. So we definitely have not been sitting idle on this issue. And just to a previous question to the member opposite, the proposal from the Metro Housing Nonprofit Housing Association, the proposal did go to community services. So just so why it's not necessarily with our office, but it is with community services.
The Honourable Member for Halifax-Needham.
I thank the minister for his clarification. Minister, on the Horn-Goodyear situation, I recognize you don't have the legislative framework, but this legislature has the ability. The government has the power to put in place a legislative framework to deal with this situation. And that's my point. We cannot allow this to go on and on and on and on and on without, frankly, we've got the hammer and we're not prepared to use it. And that's what I'm saying to the minister. 10 years? How long are we going to let this go on? How long are we going to allow two highly trained, highly skilled medical professionals who deserve a little bit of justice, as the people of Nova Scotia deserve to have them working at their capacity in our healthcare system? And frankly, it leaves me speechless that we allow this to continue. So I'm not going to really ask the minister to stand up and respond to that. That's my point to you. Well, perhaps you can answer in this next question. I want to ask about the assessment. If there's been any assessment done of the low-income diabetes program that was introduced. It's a program that we all really were looking forward to. We were really glad when it was introduced. But there have been some criticisms of the program and the fact that people have to have the money in their pocket to get the supplies and the things they need up front, and then they recover it. And that's the whole point of having a low-income diabetes program, is to help people who don't have the money get these things. So has it been reviewed, and is there a report? Is there a plan to do a review? Is there a plan to address specifically that problem?
Honourable Minister of Health.
2.5, right? Thank you, Mr. Chair, and just to finalize the discussion in regards to the two doctors who are currently under review at Capital District, that we've asked the DHA to come back with changes to their bylaws I have approved those revisions to their bylaws to allow this dispute to finally be finalized, hopefully in the very, very near term. So we will not go along any longer. But we didn't have to bring down the big hammer of legislation, but it would have been next. Should this not be resolved. When it comes to the low-income diabetes program, which is a program I think that has been phenomenal and it's going to be helping lots of Nova Scotians. You know, the conundrum we were sort of in on the rollout of the program because we did not have the IT solution to administer a pharmacare program in contact with the pharmacies. But we felt it was probably just as important to roll the program out and get the medications to the diabetics that required them. I am very happy to announce or to re-announce that the recipients or the patients can now get their medications with only the copay, except for I think one retailer is still having problems with the IT solution and making the connection. So low-income diabetics can now go into the pharmacies with and get their supplies as anyone would with any pharmacare program.
The honourable member for Halifax Needham.
Thank you very much, Mr. Chair. And I want to thank the Minister and the Minister's staff, and I would like to pass the remainder of the time to the honourable member from Shelburne.
Chair recognizes the honourable member from Shelburne.
Thank you very much, Mr. Chairman, and I do appreciate the time to talk on this important topic, especially from Shelburne County, and I know that my colleagues across this beautiful province share this valuable time. I think we can talk for a number of hours, and we will on this particular issue, of all the improvements that we can do or suggest to do under the health care system. It comes down to one basic, simple solution, and I suggest that it is all about finding money to do this. And my question to the Minister and his staff is, will his government and the Minister fight for an amendment under the Canadian Health Care Act? Because my understanding is that the funding now is based on per capita to each province. And I suggest to you that we have an aging population, that this giant iceberg is moving through our system, and that I encourage the Minister and his staff to go in this approach to get more federal dollars so we can address these issues, especially dealing with health care. And we have an aging population that is different compared to other provinces. So that's my first question, Mr. Chairman.
The honourable Minister of Health.
Thank you very much, Mr. Chair. And the solution to all problems apparently is, of course, finding more money. Unfortunately, it's not always the case that we can't grow a budget more than we have. The honourable member does talk about working with the federal government, and this was something that we continue to do and continue to have the discussions around CHST, the Canadian Health Services Tax, and how that number is distributed across Canada. Of course, in the news through the Council of the Federation, the premiers have been talking about the equalization gap of Canada, where we have provinces who are doing extremely well and other provinces are not doing quite as well. So we do have to have a better distribution of funds for all programs within our province, within Canada, and it's one that I'm very proud that our Premier, as well as our Minister of Finance, and all ministers that sit at federal provincial tables, that we continue to make sure that we have our fair share of funding from the federal government. And I can commit to the member opposite that I will continue working with the federal minister, Tony Clement, on programs to make sure that we have money for wait time guarantees or wait time benchmarks, that we continue to have money for the expansion and replacement of medical equipment, that we have extra funding for other programs that come along that should be shared. But I also have to say to the minister, to the member opposite, that the purview of health, as laid out within the Canada Health Act, that it is the purview of the provinces. So that's been our challenge up to now, but we will continue to do our best to make sure that we have our fair share from the Canadian government towards healthcare.
The honourable member for Shelburne.
Thank you again, Mr. Chairman. Again, if you're familiar with Shelburne County, our incentive packages to attract professional or doctors to our community has been addressed, I believe, through a private member's bill in a few years back. And our community and county has struggled for a number of years to attract these professionals to our community. If you look at the long term, and it's interesting, I note a personal story within Shelburne County of parents who cannot get their child in medical school. And it's interesting to note the story because to me here's a good example of that individual getting their education and eventually coming back to our community. My question to the minister and his staff again is that these rural communities across Nova Scotia are struggling to find long-term approaches to their professional healthcare needs. And to me, as a simple logic explanation to this, is that the Minister of Health and his staff should be suggesting to the medical schools in our province that they should be designating seats for rural students to educate themselves, and hopefully our community will support these students, and these students are committed to come back to these communities. And again, my question is that these seats has to be designated because these students that's coming from our communities are competing with international students. And again, I ask you, this is a common sense approach of trying to address an issue that is going to help us down the road.
The Honourable Minister of Health.
Thank you very much, Mr. Chair, and through you to the member from Shelburne. And just want to commend that community. It's done fairly well over the last number of years to recruit different physicians, but it, like other parts of the province, has had some difficulties in retention. And I think that's sort of our trick, and why the member opposite brings up the issue of taking students from our communities, helping them get through medical school, because we have a much better chance in getting them to resettle back at home. The School of Medicine does sit with our recruitment committee and does play a large part in the recruitment of doctors in Nova Scotia. There are discussions ongoing of how to better that situation, and I too agree with the member opposite that it probably would roll down to the designation of a few seats to try, maybe even as a pilot, to try this out just to prove it, because I know and you know that this probably should work. So I look forward to the discussions with Dalhousie, but we also have an opportunity here. It's not just when the medical school, but we also have to look at the availability of doing their residencies in our local communities as well, because we only have a certain amount of residency seats that are sprinkled around Nova Scotia here, Capital District, and a few other facilities across the province. And it would be nice to see them in places like Yarmouth or Shelburne, where we could be able to do some residencies there, because as they get comfortable in a community, hopefully they can stay in those communities.
The Honourable Member for Shelburne.
Thank you again, Mr. Chairman, and I'm going to ask the minister, after I sit down, for clarification on what I thought I heard. I thought that may be an opportunity for a pilot project on this. I'll ask him for his clarification on that. But anyway, I think that the questions that I brought forward here is a common sense approach to addressing a major issue in our province. And I suggest again that we have this major iceberg of this aging population, which I'm part of, the baby booming generation. If these issues aren't addressed, we're going to continue to hear stories, and I'll tell you a few from my communities, of residents in my community who their wife is in an establishment 50 kilometers away in one direction, and their sister is in the other direction of another 50 kilometers away. And I asked the chairperson to make that decision for that individual. What direction do you go in each day to accommodate your loved one? We have veterans that are going to our hospitals now, and they simply do not have a bed for them. These veterans did not turn away from us when it was his or her duty, but our health care are turning away from our seniors and our ill. We have personal stories. I can tell you personal stories of people who are patiently waiting for heart transplants. They are patiently waiting to go in to have a bid to do the preliminary tests so they can be in line for these operations. We have people who are waiting for operations of knee and hip, and their schedules have been canceled. And they travel a great distance, not only to Halifax, to Kentville, people from Shelburne County. So I go back to the minister and ask for that clarification on the question about the pilot project, first of all. But until we find more money and until we do common sense approaches to these, we will not have solutions. So hopefully the minister can address some of these questions.
The Honourable the Minister of Health.
Thank you very much, Mr. Chair, and through you to the member from Shelburne. And as I talk about pilot projects and discussions with the medical school, we want them to be a part of a total solution for Nova Scotia. At this point, our discussions with them have been good, yet they are very reluctant to designate a seat for one student or another. They feel that they should allow all people apply for those seats. But if we look at other jurisdictions like New Brunswick, like Quebec, like Ontario, there are certain schools that have designated for those local students. So I look forward to continuing my discussion with the school through the deputy and through the departmental staff to look at an option of maybe a pilot project to find a few students and run them through the system and see how well that works. But also the expansion, I believe, of the residency program helps out a whole bunch too. Case in point that I have an acquaintance that had to go away to medical school because she could not get accepted here in Nova Scotia. So she went away to where'd she go? She went to Hungary for the first year. She's in the Isle of Saba right now, which is somewhere down in the Caribbean, which I'm sure is even hotter than here, which is hard to believe on a day like today. But she's now having a challenge of finding a residency spot in North America. And to find a residency here in Nova Scotia would be phenomenal because we have a Nova Scotian who would go through her residency here in Nova Scotia, and so the chances of having her stay would be phenomenal. The medical students, if we talk about, without designating seats within the medical school, we can talk of over 100 are being placed in communities right across Nova Scotia that come from Dow. In Nova Scotia and New Brunswick, we see them still stay within a certain radius of their medical school. But Mr. Chair, again, on the retention of these, I think it's very incumbent upon all communities in Nova Scotia to try to make the best life possible for those medical students, those medical grads that are coming to our communities, whether they be from Nova Scotia or be from all points of the globe.
The Honourable Member for Shelburne.
Thank you, Mr. Chair. I'd like to turn my time over to my colleague here, and I want to thank the minister for responding to my questions. Thank you very much.
The Chair now recognizes the Honourable Member for Pictou East.
Mr. Chair, through you to the minister, are you aware, Minister, of the release in Ottawa today of the final report of the Federal Advisor on Medical Treatment Wait Times, Dr. Brian Postel? He's the CEO of Winnipeg Regional Health Authority. I'm getting right into my questions. I have a series of them.
The Honourable Minister of Health.
Thank you very much, Mr. Chair, through you to the honourable member from Pictou East. Just trying to figure. I'm just picturing Pictou and where you belong, and thank him for his question. The Brian Postel report has been one that we've been able to be briefed on. One that the province of Nova Scotia totally supports. It's also one that talks about some of the costs and where the funding should come from to address the critical wait times in Canada. And we're hoping the discussions will continue with the federal minister and the federal Department of Health in trying to make services better for all Canadians.
The Honourable Member for Pictou East.
Mr. Chair, I understand that Dr. Postel is looking at some of the systemic problems that exist, and he's pointing out, at least in some of the leaks that have come out, about the fact that increasing funding doesn't necessarily translate into better service. And I understand that this 76-page report is a must-read for all Canadian politicians. And I hope that we at least get 52 copies of that. Having been briefed on the report, I'm wondering if the minister is willing to look at some of the content, particularly some of the things that relate to protection of turf and the perhaps even to look at an accountability audit. An accountability audit, I believe, is perhaps a key to this whole thing, because the money going in sometimes doesn't translate into better services. And for example, if a piece of equipment looks a little bit better but is the same as something that is worth $10,000 and you pay $40,000 for it because it looks better or whatever, that doesn't do anything for the system. So what I'm saying, will there be any consideration to accountability auditing within our hospitals?
The Honourable Minister of Health.
Thank you very much, Mr. Chair, and through you to the honourable member from Pictou East. Just to give you a quick rundown of some of the information held within the postal report, and things that actually we support, and some of the processes are already undergoing here in this province. Ultimately, the biggest one that we've been working on is, of course, information systems, making sure that we have the IT solutions there to A, know what our wait times are, and to find the solutions to remedy them. Looking at centralizing management of wait times. Far too often, wait times are handled by particular surgeons or particular doctors. So we need to find a better way to bring those wait times into a central area. The other thing, Mr. Chair, is a lot of times that some people are on 2 or 3 different wait lists. So we need to get a better feel of that data that is required. Mr. Postal also talks about research for looking to connect between wait times and health outcomes. Because right now, when we look at a wait time, we basically poll someone to see if they're on the wait time and how long they are, or we do an exit survey to see where they are. So we want to be able to find that integration and find out what the outcome is as well. The Postal recommends having patient navigators to work with patients on wait time. So somebody that's on a list knows where to call and has that one person that they can call on a semi-regular basis to find out how they're doing, where they are, and if there's any change in their process. Because right now, you go on a wait list, you have no idea where you're at for the most part. So it's a better use of time. Also, to revise on re-engineering process, such as they're looking at the Calgary orthopedic pilot. There's a whole bunch of places that we don't need to reinvent the wheel. We can look at what's happening in other jurisdictions in Canada to help our wait times. As far as the audit that the honourable member talks about, we are currently in the process of an audit. I mean, the FSOR, and I don't know who came up with that acronym, but it's great. Sounds like a phaser or something. But ultimately, it's to look at a snapshot in time of where Nova Scotia's tax dollar is going within the system and analyzing the outcomes to see if we're doing it right or doing it wrong, or what those recommendations to change it would be.
The honourable member for Pictou East.
Mr. Chair, to the minister, to what degree have housekeeping services been cut in our hospitals, and the possible impacts of less soap and water or cleaning or whatever you want to call it? And what I'm referring to is post-surgical infection. The post-surgical infection rates, perhaps in comparison to other jurisdictions. I don't know if anything has ever been done in that respect. However, other jurisdictions have also cut the cleaning potential within the hospitals and so on. And this is becoming a concern that is being expressed by a number of people, that sometimes it's safer to be home than to be in our hospitals. And there are a whole series of items that could be listed as instances of very poor cleaning that is done in some institutions. And in some areas there has been, in fact, privatization of services in many jurisdictions today. And this is a concern that a lot of people are expressing. And I'm wondering if the government is looking at that.
The Honourable Member of Health.
Thank you very much, Mr. Chair, and to the member opposite, and thank you for the question, because I know we had a little discussion about that yesterday in reference to a gentleman we were chatting with. The Department of Health has not directed the health authorities to make cuts in housekeeping, and as far as we're concerned, we haven't seen cuts in housekeeping in any facility under our purview. Mr. Chair, infection control rates or infection rates here in Nova Scotia are very much so on par with other jurisdictions. So we're no worse off, but then again, we're probably not much better. So we need to find a balance. And as we had the discussion earlier this morning with the member for Sackville-Cobequid, we have implemented an infection control coordinator within the province that can work with the DHAs. Each DHA now has an infection control committee to make sure that we can keep up the standards. And don't forget, Mr. Chair, that accreditation is a very important part of our hospital system, and a large part of the accreditation of hospitals has to do with the management in their infection control and the cleanliness of those facilities.
The Honourable Member for Pictou East.
Mr. Chair, I would like to thank the Minister for the response to both of those questions. It seems that, or both previous questions, it seems that some things are being done that are concrete. However, another concern is, are there improvements in hospital staffing ratios, i.e. the numbers in middle management, some of whom are much like us. They spend perhaps entire days at meetings and so on. And one example perhaps is a committee on fragrance in hospitals and so on. I mean, what I believe and others believe may be part of the problem is that we could perhaps get along with some fewer administrative positions and have more frontline caregivers. And I know this isn't new. This has surfaced a number of times in the past, but is this something that is being looked at, the ratio of middle management and management to the numbers of people who are on the front line in caregiving?
The Honourable, the Minister of Health.
Thank you very much, Mr. Chair. And in regards to staffing levels, that's been a challenge over the last number of years to make sure that we have the correct number of frontline staff, yet making sure that we have the correct type of administration to make sure the checks and balances are in place as well. I can say to the member opposite that the Nova Scotia Department of Health, particular, not necessarily the DHAs, but we have the lowest staffed Department of Health in the country. We're pretty thin in the amount of work that we do. But I can say to the member opposite that through the 90s there was a large cut, of course, in middle management, I wonder sometimes whether some of those folks are doing more work than they should be, and things are getting missed. So I can say to the member opposite that it is not our indication that there's too much to where we're too top heavy, but I do say that our focus now is making sure that we have the correct number of frontline healthcare workers, whether it be technologists, nurses, doctors, what have you.
The honourable member for Pictou East.
Mr. Chair, to the Minister, what are the factors behind discontinuance of a pain clinic wait list after it reached 5 years or more? Is it recruitment, retention, financial? It's a very serious problem in this province.
Thank you. The Honourable the Minister of Health.
Thank you very much, Mr. Chair. The pain clinic has been particularly troubling to me to see such a long wait list for a service that is so life-enhancing for the most part for some of the patients that require it, which is why last fall we had the creation of the Pain Advisory Committee. It's being chaired by the acting chair today of the Capital Health District, Mr. John Malcolm, and making sure that we look at all the services in the province, because I think it's not just an issue of the pain clinic here, but in the absence of other services in the province, we're seeing an undue focus on the one here. So we have invested a fair amount of money to implement those recommendations as they come forward to us. And we are looking at, like I said, other parts of the province that we can offer those kind of pain services. We're also hopeful that with the increase of anesthesiologists or anesthetists in the province, that will alleviate where those patients can get the service. So I think we're well in hand of making a dramatic change there.
Thank you. The Honourable Member from Pictou East.
Mr. Chair, to the Minister, I've run into a number of circumstances in the very short time that I have been an MLA, and these are situations that people require services that can't be given within the province. So my question is, if services have to be provided in another jurisdiction and the persons do not have the resources to look after travel and accommodations, travel and accommodations are always passed on, it seems, to these people. Are there avenues of providing the necessary funding other than through community services?
The Honourable the Minister of Health.
Thank you very much, Mr. Chair, and to the member opposite. If a service is not available in Nova Scotia, and the patient has been referred by a physician, approved by the physician, we do cover the health care cost for the most part within Canada. To date, I have not had discussions or thought on the accommodation or travel costs associated with this type, but we do make sure that we do cover the health care itself cost for these patients.
Thank you. The Honourable Member has approximately a minute and a half. The Honourable Member from Pictou East.
Mr. Chair, I certainly hope that the Minister will look at the accommodation and travel situation. It is a grave one. Recruitment and retention are very important factors, and from a personal experience last fall, needing an oncologist, and the fact that we were faced with a situation where there were 6.75 positions available here in Halifax compared to 7 positions that existed back in 2000. I hope that efforts are being made to make this a better situation, because it's a deplorable thing when someone has to wait for 13 weeks for the appointment with an oncologist. Now, I understand things are in fact improving, but maybe at the expense of another hospital. I understand that an oncologist from Sydney is or has recently come to Halifax. Well, that makes the situation better in Halifax, but it certainly makes the situation worse in Sydney. So I hope that real efforts are being made, and very quickly. I understand that an oncologist was trained, was trained in the system and lost.
Order, please. Member's time has expired. The honourable member for Halifax Clayton Park.
Well, thank you very much, Mr. Chair. And it's a pleasure for me today to rise with just a few questions. I won't be taking a lot of time today, but a few questions that relate to health care. And it's always a privilege to have the opportunity as a member of the legislature to speak directly to the minister and to have with you, your staff, who are so competent in helping to advise as well. So it's an opportunity for us, which I think is very important to everyone, to be able to raise our local issues and also issues of a broader concern. I had a couple of areas I wanted to examine, and as many of you know, the Clayton Park riding is home to a large number of newcomers to Nova Scotia. It also is very important for the trend that we have, where we're trying very hard to increase our number of immigrants to Nova Scotia. And I'm very interested in the services that we provide that help to make their transition here that much easier and better. And one of the questions I wanted to raise with you was the difficulty. We often talk here in the legislature about education and English as a second language for the young families, or the children of the families that are moving here. But another very serious concern is how we provide health care to those new Canadians, and whether or not language barriers are, and I believe they are, a concern to new Canadians, Mr. Chair. As they come here, it's a very different system. It's very intimidating often, and the lack of language ability makes, as you know, even for Canadians, for English and French-speaking Canadians, a difficulty often in understanding medical treatments. So my question is to the minister, if you could address some of the initiatives that you know of that are being offered, what you know where the need is greatest, and how we might be able to respond. And I'll let you just give me your general overview, if you would. Thank you.
The Honourable Minister of Health.
Thank you very much, Mr. Chair. And this has been one of interest to me and interest to the chair when it comes to access to health care services in your own language. And especially with the French-speaking population we have in this province, I think we've made some improvements, and will continue to do so for that population. The population that you refer to, of course, are immigrants from countries far and wide, and in a whole range of different languages. And most of them being newcomers would probably have difficulty talking to our physicians in English. And what we've done is approved a position within Capital District, basically called a diversity coordinator, that can work with people within the system that require translation services, cultural discussions, helping those patients have the best experience possible to make sure that their outcomes are as good as possible within that system. Through, let's say, even teletriage, as we're talking about the program that we're going to be implementing early next year, there is an option there that they can actually call in and receive service in over 100 languages through, I think it's a call center in Winnipeg, I believe, is where they receive that service. So we are making the best of what we can on implementing new programs to make sure that there is service in a whole range of different languages, so that service can be available.
Thank you. The honourable member for Halifax Clayton Park.
Thank you, Mr. Chair. And I wonder if the minister could tell me a little bit more about this triage program. Perhaps you've mentioned it earlier in estimates, and it sounds very interesting. You mentioned that it would provide services in 100 languages, and I assume it is a distance form of health care or health advisory. Could you give me a little more information on that and how that might help people that live in my constituency and here in Nova Scotia?
Thank you. The Honourable the Minister of Health.
Thank you very much, Mr. Chair. And then the program that I'm referring to was held within I think it was the Speech of the Throne, and as well as the platform of the Conservative Party during the last election, and talking about basically a telehealth teletriage program, which would be a phone number that our citizens can call to get base advice on health conditions. And the idea basically is to have services of RNs answering the phone, helping them through their ailments, making suggestions on treatment, as well as suggestions to see an ER if they require. The program as it stands right now is basically a copy of that one that's in New Brunswick. You do have your local RN service here, but when you do fall into a problem of not being able to understand language and being able to understand the caller's needs through the Canadian, through this implementation across the country, there's a service from a Winnipeg telecenter that would offer those services in 100 different languages. So that is basically the premise of that system. Also to the members' interested in this, we're looking to design a program to educate immigrants on how to use the SELF system. So no differently than maybe ESL as people come in and have to learn English or another one of our official languages. We should be able to provide them with an idea on what our health system is, because our health system in Canada is even a fair amount different than that one in the U.S. That's even different than that one in different places around the world. So we need to do more work to help our immigrants that way.
Thank you. The honourable member for Halifax Clayton Park.
Yeah. There's at least one organization that I know of that does offer translation services where there are volunteers that will be matched. I wonder if you could tell me how they are utilized within the system and whether there's any support for that nonprofit organization to just support. I know that the translators are volunteers, Mr. Chair, but I'm wondering if there is any support for the organization. I believe it's been around quite a number of years, perhaps 10 or 20 years, and I wanted to know how we are helping to keep that organization viable.
Thank you. The Honourable Minister of Health.
Thank you, Mr. Chair, and through you to the Honourable Member from Halifax Clayton Park. As far as I understand right now, and the way that service is offered through the DHA, in particular the Capital District Health Authority, that they basically contract that service from this organization. I'm unaware of how much that costs, or if it does cost at all, or if there's any supports there. But I could endeavor to find out some information for you, as again it's under the purview of that health authority.
Thank you. The honourable member for Halifax Clayton Park.
And thank you very much, Mr. Chair. Again, for the Minister, I would appreciate that information if you could. Often the fine level of detail is not available, or it would be in budgets from the District Health Authority. So we would appreciate it if you could find that and just give me a little bit more background on it, because certainly I do worry about the access to health care where people are intimidated to go forward, or they are unable to access it. I think it's worth noting that in HRM, the second language, the second most prominent or prolific language in the HRM is now Arabic. And in Clayton Park, that's very visible in the community and in our schools. And we had a discussion at Community Services, I believe it was not long ago, about around MISA and some of the services offered to new immigrants. And one of the things that came out is that often, particularly the women at home, do not acquire the language, that their children are learning English in the schools, and often the husband is working and acquiring English, but the mother who's home and a caregiver doesn't usually, or there's a risk that they will fall between the cracks and not get the language training they need. And they're usually, as the Deputy Minister and Minister will know, it's very often the woman in the family that accesses health care on behalf of the whole family. And that's true in our own culture as well, that the women are the most familiar with how you go about accessing and getting the services you need. So I think that as the caregiver in that case, it's very important that we reach women and that we know that they have the services they need, and that we find a way to just demystify the system. And I think your idea of educating, providing some kind of education through either ESL, through the schools, or some other social nonprofit group would be very helpful as well, because it is a very important part of life in Canada. So leaving that one aside, I'd like to talk a little bit about self-managed care, and I know it's come up a couple of times. I had lobbied strongly on behalf of one of my constituents with the previous Minister of Health and his staff to get the kind of health care needed for a person in my riding who is confined to a wheelchair but does work. And there's a difference that was quite noticeable to me, in that his concerns around the home care he was receiving was the dependability of the hours of service, because he had a job to go to, and his is actually a job that had different hours. He often works night shifts, and it has to be picked up by the accessible transportation at a certain time in order to reach his job and work the shift through the night. And because his care is quite intensive, he requires at least 2 or 3 hours of care to get ready and be up and ready for that transportation to work. And home care doesn't always guarantee the time at which they come, and there's a certain amount of flexibility around that, and often with his afternoon shifts it might interfere with the way the shifts ended for it was the VON in this case that does it here in Halifax. The shifts would often not be conducive to the time that he needed, and it was a big problem. And my hope at the time, Mr. Chair, to the Minister, was that this new self-managed care, that we would allow individuals, by putting their care back in their own hands, for those that are able to manage the arrangements of the administration of that we'd give people more control over their day and their care, so that they could pursue the other things that are important in life. And I don't want to see people who are severely disabled being unable to access the work that they can find. We've talked here on a number of occasions about people who are disabled and their high rate of poverty and their inability to find work. And when we have somebody who has, a good job and is able to perform that work, we need to work very hard to make sure they can maintain that. And so home care was an issue with this individual, and in fact had been cut off because of various disputes, let's say, around how things were going. And my lobbying at that time, my advocacy on his behalf, was to see that this individual could get the control he needed, so that the money could be put in his hands and he could access care. My hope was that self-managed care would provide that for him. And during the election, when I had spoken to this family at the doorstep, I was told that they're very happy that self-managed care is here, but it doesn't serve their needs. They said that, and I don't think this is entirely correct, but I'm hoping that the Minister can correct my understanding, and that was that nursing care was not available, that this individual needs really medical nursing care, not just housekeeping or that kind of care, and that he can't access it through self-managed care. So I'm wondering if there are restrictions, if you could explain to me a little bit more, because my hopes were very high, my expectations were high that this would be a real godsend to certain people that have need of daily home care services. And the fact is, it hasn't met or measured up to the expectations of this particular family in the Clayton Park riding. So I'm anxious to know if there are some restrictions. Is it a financial restriction, or is it a restriction on certain services that might preclude a person who's confined to a wheelchair? That's the situation here. He needs medical help each day to get up, to do the exercises he needs, and other physical care. So I'm wondering if you could address that, about whether or not there is a shortcoming or perhaps a misunderstanding. Thank you, Mr. Chair.
The Honourable the Minister of Health.
Thank you very much, Mr. Chair, and through you to the honourable member. The self-managed care program, which started last year, I think is a fair step forward in an option for care for many disabled and some of our seniors. When it comes to that, it is basically a program to allow people to remain independent in their community as long as possible. The limit really is $3,500 per month. So I don't think there's a $3,500 per month. So it's up to, depending on your requirements and your assessment. Just trying to read through the requirements here, but it does say that registered professional health services like nursing continue to be provided through the home care service. So I'm just wondering, that might be a bit of a shortcoming here to the true system of home care. Just for the honourable members' information, that as of June 15th, there were 15 individuals who have become self-managed care clients and signed those contracts with the Department of Health. But I'm interested in maybe researching the issue around nursing or health professional care within this package. So, and I think I would get back to the honourable member just to see if really that is whether that's a shortcoming or it's a project program design. But also to say that we've increased self-managed care this year, basically doubling it and adding another $1.75 million to it this year alone.
Thank you. The honourable member for Halifax Clayton Park.
Thank you. I'm interested that the amount has been doubled, and I mean, I do think this is a program that needs to be extended, and I think the evidence of almost 10 years, I believe it was a full 10 years of the pilot program that was initiated under the Liberal government in the 90s, showed that the people that were on that program were extremely happy. In fact, the attrition rate had been very small. I think only 1 or 2 that had moved away had stopped accessing the pilot project. So we had a lot of evidence that this is very good and helps people to have control over their lives as well as accessing the care they need. And it takes some of the bureaucracy out of their lives, which I think is important. My concern might have been that the $3,500 perhaps, and I had mentioned this to our health critic who said perhaps that isn't enough to access daily nursing care, and I'm not really sure, but that might be something that I could bring the individual case to your attention and we could look at. Why they feel that they're not eligible to even apply or to be part of it. Because I do, my understanding was that this would really improve their lives to some degree. I wanted to go back for a minute to the credential recognition. I guess we're looking again at immigration in a sense. One of the biggest issues that I run into when we're talking about immigration and talking to newcomers is that it either affects them directly or they have friends it's affecting. And that is that many newcomers arrive in Nova Scotia and cannot practice the professions that they've actually been selected to come here as a result of. We set very high standards in Canada for the level of education and skills and financial resources that a family has when they arrive here in the country. A lot of that's related to the profession that they bring with them, and then of course they run into roadblocks. And the medical professions are no exception. And this last year you had introduced a program called the CAP program, which was to help, as I understand it, to help those trained doctors, maybe other medical people as well, but I understood it was doctors, to get their certification and be recognized here in Canada. And there are some shortcomings in that program. As I understand it, it's very difficult to qualify. But I wonder if you could give us a little bit of an update on where you're at, because this is a tremendously important problem. I'm sure the Minister of Immigration is here at the moment too, so she will recognize this too. If you talk to newcomers, this is a huge problem for them, and we have a lot of people that are qualified, I'm sure could be mentored into the system properly, but they're not being used at all, and we have at the same time, on the other hand, huge needs in our medical system. More doctors are needed and more nurses, and we're not using those people that have the skills. So could you give me an update, please, on the department's response to those issues?
The Honourable Minister of Health.
Thank you very much, Mr. Chair, and through you to the Honourable Member from Halifax Clayton Park. In the reference to the CAP program, the Clinical Assessment for Practice program, has been one that has worked relatively well. Of course, when we come to the requirements for physicians, especially international medical graduates, we have to basically leave that oversight to the College of Physicians and Surgeons in what they feel are adequate practice levels, adequate practice training. What we've been able to do is that during this CAP assessment that we've had hired, I believe it's 11